afternoon, good evening, good morning to all people in the parts of the world. I am Dr. Unati, your host. Let me know if you can hear me. Today is a unique show. I am a solo show today. I am your guest and your host. So give me heads up. I can see people are coming on. Give me heads up. Thumbs up if you can hear me. Today, I am discussing with you. It's an interactive discussion. So let me know if you can hear me. Please drop me a comment and let me know where you are tuning from. And of course, let me know if you can hear me. Again, today I am coming to you guys with a topic that I'm very passionate about. As you know, I'm a family physician and a health coach. I focus more on men's health. And I think because in the world, we talk a lot about how men commit suicide, or probably how there's many men out there that are homeless if you compare the stats. And of course, if you look at also people who are homeless, it's mostly men. And the gender-based violence, of course, I'm not underestimating men that are the victims of gender-based violence. So today, our topic, as you can see on our screen, it is postpartum depression in men. I am your presenter. As you can see, our show started off with showing you art, which we're going to talk about as we go along. So today, as I said, we are talking about postpartum depression in men. It's a very underdiagnosed condition. And of course, a lot of times we focus on the mom that just had a baby, and we underestimate the effects a new baby has on the father. So today we're going to talk about that, and drop your questions, drop your comments, let me know where you are tuning from. So, you know what? As we look at the statistics, actually, according to the Journal of American Medical Association, they basically tell us it's 10% of dads, new dads, that have postpartum depression at some point in their lives when they have a new baby. And that's quite a remarkable percentage when you look at it. And the fact that a lot of times men, they tend to downplay these symptoms. So we're going to take a deep dive on the symptoms and, of course, basically how men present. And a lot of times people think it's mostly women that are affected by pregnancy hormonally. Actually, even men, they get affected by pregnancy, even during the pregnancy of their partners and postpartum. So basically, men, they do have low hormones. You know, your happy hormones like your dopamine, your serotonin, they do go down as the stress is accumulating. You know, the anticipation of your new baby, this could actually affect your happy hormones. So today we're going to talk about what could lead to postpartum depression. And of course, like I said, sometimes it starts during the time your partner is pregnant. And what could be the risk factors? A lot of times it's usually a pre-existing depression in men. And looking at the stats, when you look at the stats globally, you know, currently, according to the stats, globally, we have 264 million people living with depression, but this includes women, men, and children. But the interesting part on that stats, it's men that commit suicide. And interestingly, people that come to us clinicians, physicians, psychotherapists, it's mostly women. So this stress is quite interesting because men, as much as they don't come to us presenting with their symptoms, as like I said in the beginning, a lot of times men downplay their symptoms. You know, there's a lot of cultural component. Men have been lied to for the longest time, for centuries, to be stoic, to show up to the world, and not to show up their emotions. So that's basically the biggest role that causes these stats to be higher in suicides, because it's when a man has reached, you know, the saturation point, and then unfortunately a lot of times people commit suicide. So usually it's a pre-existing condition of depression, or maybe family history, you know, of depression. It's basically similar to women. And the other interesting thing that happens to men to get to a point of depression during that postpartum phase, you know, the guilt. You know, a lot of times it's women who show the excitement of the new baby, you know, the connection. Because remember, us women, we have the baby for the 9-month period inside you. So the connection is there, the maternal energy is there. But for men, sometimes it takes longer for them to connect with the baby. So guilt can kick in. So that's when sometimes, because of that guilt, you start having all these negative thoughts, you ruminate, and the guilt of, why am I not feeling the excitement my partner or my spouse is having? That could actually lead to depression. And also another one, which we see a lot, and a lot of times people don't talk about this, it's when men feel suddenly this new baby is taking his or her position, his position to his mother, to the partner. Suddenly, obviously, it's natural for moms, to focus on the new baby. So men, sometimes they do feel neglected. And actually, this is the highest time where we see extramarital affairs, because men, they feel the loneliness, they feel they are neglected. So, as we always say, men, as much as we believe that they are strong, they are stoic, but I'll tell you this, they are also emotional beings. It's been a wonderful 1.5 years to work with men, and seeing how passionate and also how compassionate men are, and also how emotional they are if you let them be and give them that space. So that's basically one of the components where we do see men getting or falling into depression, because of feeling lonely and feeling neglected by the partner. So another factor is, suddenly you feel the pressure of the financial stress, because there's a new addition now to the family. So as I said, usually culturally, we let men be the leaders of our homes, of the society. So sometimes it could lead to a lot of stress, and of course, I could lead to depression. Right now we are on COVID-19. People lost jobs, both women and men. But men, they still feel the pressure of leading, the pressure of what's going to happen now. We have a new addition to the whole, to our house, to our family. I need to provide. So that could actually lead to depression. All right. And this is the time where it's very crucial and critical for men to mind their symptoms. Now I'm going to talk about how men present. Men, they tend to present slightly differently compared to their counterparts. Men, when they are depressed, they tend to be irritable. They tend to be irritable. And that's when sometimes that violence kicks in, the anger. They have anger spells. And of course, the isolation. Or sometimes they work a lot. A spouse or a partner could easily get excited thinking that, my man is working a lot. We're going to have that extra cash. We're going to go on holidays. A man who is depressed can work a lot, can exercise a lot, can isolate a lot. Suddenly, the soccer games he used to enjoy, or the going out with his friends he used to enjoy, probably could be neglected because of feeling depressed. And obviously, the obvious symptoms, the feeling down, the feeling not worthy to be here, right? I don't feel worthy to be the father of this little child. I cannot provide. So these are the things that men play in their heads, and of course, could lead to depression. And of course, other symptoms would be the suicidal thoughts. I don't want to be here. I don't want to be here. And again, like I said in the beginning, also men, they are neurotransmitters, the chemicals that we have in our brains, the serotonin, our happy hormones, basically the dopamine, could drop during this time. So we don't want to say it's only women who are affected by this phase, because it's challenging. The baby that you come back from work, you come to a child that is not easily consolable. A child who has probably colic. You could never tell when is the baby gonna sleep. So that can be very frustrating, and also can bring a lot of guilt when a mother has to stay up and feed the baby, and a man is probably sleeping. So that can also bring a mixed emotions. You're feeling the guilt that you are sleeping. Obviously, you are sleeping because the next day you're going to work, or just the frustration of the sound of your crying baby. I know it personally. When I had my baby, sometimes the scream, it used to irritate my ears. So this happens to men. We need to give men grace. We need to give them also the compassion of understanding. They are also humans. They are also emotional beings. This today's discussion is to bring to our attention that men are also emotional beings. Men are also emotional beings. We need to be sensitive when we handle them. We also need to be sensitive to also what they have to share. Because a man that is depressed, like I said, goes to that shell. It goes to that shell. So you have to be paying attention as a spouse or as a family. All right. And of course, there's other symptoms that, if there's any clinicians that are watching with me here, colleagues, pay attention to the symptoms these men come with. A man that is depressed during this time could come with back pain. A back pain is a very non-specific symptom. Can tell you, doc, I have back pain lately. I have headache. My stomach is upset lately. I have this nausea. These are all non-specific symptoms. You could easily give your patient maybe acetaminophen, like Tylenol, Panado, and could go ahead with life and leave your office with all the symptoms you have not unpacked. So any back pain in a man needs to be unpacked. Any headache in a man needs to be unpacked. And of course, there's other causes. High blood pressure could cause high back pain, headaches. So there's a lot of things that we need to give grace to men and listen to their symptomatology. All right. And of course, like I said, these symptoms, when they are ongoing for a period of 2 weeks or longer, diagnosis of depression is made. And I want to let you know this. Also, men, they do develop the postpartum blues like women. The feeling low, the fatigue, you're tired, you're not sleeping. Your baby keeps you awake. As much as you are excited to be a new dad, it's exciting to be this new father. You have just brought a little soul to the world. But this can also bring a lot of anxiety. Men do get anxious too. They do get panic attacks. I saw it in my own partner, in my own spouse. He was also panicking a little bit whenever our child would be crying. We wouldn't know what he was crying for. So men feel the same. Men feel the same way as we feel as women. And women who are watching here, let your man be. Let him be a human. Let him be an emotional being. Let him feel. We all have emotional centers. We all feel. We all have these emotions. We all have these hormones. They can play us up and down. Men also experience that. So, how do we help depressed men? It's 2 weeks period of all these symptoms. Please visit your physician, visit your doctor, visit your nurse practitioner, visit your nurse in the case of a nearest clinic. These symptoms could be explored, and we do treat depression. A lot of times, people, men, they stay home, they downplay these symptoms, and then this is when now things get worse. What happens, men, in the midst of trying to cope, what do? Some men, they go gambling. Now taking the money, maybe limited resources you have at home, start going gambling. And this could also bring a lot of stress now to the family and your relationship. Men, they start gambling. Some, they drink a lot more. Those that drink alcohol, or some, they even start exploring with other drugs. Cocaine, we do see this, cannabis and other things. So we need to help men when they present, or when your man, if you're a woman here, you need to start creating this safe place for your man. Check on him. How is he doing with his new baby? How are you coping? How is it affecting you? When you start asking those questions, those open ended questions, you are creating a safe place for your man to be free and to be, and also to be emotional with you. And this also connects you as a couple. All right. So, as like I said, these symptoms will occur for 2 weeks. Seek help. Please come seek help, because we do treat depression. Depression is treated for at least months, a minimum of 6 months. And some people, they need to be on medication longer. Like I said in the beginning, some people have a pre-existing depression that gets magnified during this time. It's a very hectic time. No one knows how this new baby will change. In fact, the fact that there's a new baby, there's a new life in your life, things change. The traveling you used to do, they reduce sometimes, the work hours, the going out with friends. So these are the new changes. We need to allow men to get the time to change. Sometimes we don't give men the grace and the time to change. This is a new adjustment. They're not going out with their boys. They're not going out because they have to come help you. So we need to give them grace, the time of adjustment. All of us, we need time. Each person has his or her own pace. All right. So these are the things that, to enjoy this new gift now that you have, you need to work as a team. You need to work, and of course, seek help. Ask for help from families. I said last time we talked about the postpartum depression in women. If you're a friend here, you have a man that is expecting a baby. Nowadays, I even see men, they are doing baby showers for each other. I love that because now men are realizing that we are also humans and we are emotional beings. I love it. I have a friend actually whom his friends threw a baby shower for him. It was beautiful to watch. So these are the things that we need to start embracing in our cultures. It has nothing to do with, oh, this is something for that other culture. And again, I want men here to remember depression or this postpartum depression is affecting every race, every socioeconomic status. It doesn't matter what role we have in the society, this can hit you. And remember, a lot of times, some cultures or some societies, they don't allow men to go on paternity leave. So these are the issues that could affect men. All right. So we need to give men grace. I want you guys, when you leave this space, to remember this. Men are also human and they're also emotional beings. And like I said, when you start creating this space, the safety for your man, things get really fuzzy and warm in your relationship. All right. So, how do we treat depression in men? Few things. I like the psychosocial approach. Of course, we look at how severe your depression. Depression can be mild, moderate, or severe. So we basically have a way of looking at that. We look at this with the questionnaires we use when we're asking the history, the severity, and of course we use our discretion. So medication has its role. Like I said, 6 months minimum period, you can have your medication. And some people, they get over it. Some of us, we live in the coldest, areas of this world. In Canada, it can be very cold. So if you are in such an area, it's winter time, you need your vitamin D. You need vitamin D. Is good for your emotions. It's good for your immune system, because you need your immune system. When you have poor sleep because of your little baby that is crying all night, your immune system could be lowered. So your immune system, your immunity, you need to be taking all those supplements. So your vitamin D is vital. It's very important to get it into your system. And of course, look at also what can you do outside. Initially, I showed you one of the things that is very special to my heart. My partner, my spouse, is actually, amongst other things he does, he's a long time artist. I've always wondered how this man had kept his emotions so leveled and grounded, and how he manages his stress. It's the gift of actually science of art. Art is very fundamental nowadays. Nowadays, we have actually absorbed other forms of healing, not only just medication, art, theater, music, sound. These are the things that help us release our happy hormones, our dopamine. So, as I said in the beginning, we need to look at you holistically. Look at your diet. How are you eating? Right? Some people, they don't eat healthy. There's a new baby now. Now there's a lot of companies now that have brought easy ways of making things easy. There's prepared foods. You can just throw it into the oven. So there's a lot of things, and there's family members that are always willing to help. Let people help you. People sometimes, they go into this isolation and do their things. You have never been a parent, and it's different each time. Even with your second child, if with your third child, things are different. Let people help you. I come from a culture where we say it's the village that raises a child. So you're not all by yourself. Let people that are around you help you, and seek help. Have that confidant, have that man in your life that you can talk to and share your thoughts, or even a woman you trust, or your therapist. We tend to see less number of men going for therapy. Let's normalize therapy in our families. Normalizing therapy in our families, not being reactive, improves the quality of relationships, improves the quality of our families, improves the quality of our health. When we start normalizing therapy, or even actually before having this baby, prepare yourselves. That's why nowadays we see women, also even men, accompanying their women to go for prenatal classes, what to expect. Learn those things. It's not, I come from a Black community culture where people think, oh, it's a white thing. No, it is. And nowadays, we live away from our parents. In my case, I'm away from my mother. So these are the things, you will get the resources around you and use them. Use every resource around you. All right. And normalize therapy. Go for therapy. Share your insecurities. Men get insecure too. Share your insecurities. Share your thoughts. Share your fears. You are human. You are human. And the most beautiful thing about men is men who are in touch with their emotions, men who are sharing their vulnerability. Those men, they live longer because they do not internalize stress. They do not repress their stress or their emotions when they are hurting. So, like I said in the beginning, women, create these spaces, create this safety for your men, create your safety in your home, make it warm in your home by creating all these resources for him. All right. Like in the beginning, we talked about how depression is not only just during the baby blue phase. Men, do not downplay that period. It can be prolonged sometimes. Baby blues can be prolonged. Some people, they, a lot of illiteratures out there, they will say 2 weeks, sometimes 3 months, 6 months. But I said, if you notice your symptoms are lingering in your head, and they've changed you occupationally, they've changed how you behave, you've become more irritable towards your spouse, your friends, you are isolating, this is time for you to seek help. And also, friends that know you, listen to their assessments. People that know you better, listen to their assessments. I know sometimes it's easy for us to go into that defense. And when people start telling you, man, you are drinking a lot more lately, pay attention to that. Because once you start bringing that excessive drinking or use of drugs to all this new life you have, this is the time we see failed marriages. This is the time we see failed relationships. And again, yesterday I mentioned something about maybe your relationship ended because of this time. Men can also be fearful when you share the news that you are pregnant. This could bring a lot of fear. It could bring a lot of, oh, I was not ready for this. And some men could unfortunately run away from their responsibility, So this is a very life-changing period for everyone, men and women equally. So this is time where men need to have that person they trust, they could share their thoughts with, and then they can have the presence their child needs. This world needs more fathers. We need more empowered fathers. Today, we have a troubled world. We have gender based violence. We have all this dysfunction in the world. A lot of times, it's an absent father that was not there, or an absent mother. Because we do see, I want to give men grace. I have friends and patients that are raising their children. Men, I'm talking about men, empowered men, So we need to empower men in order to have our leaders out in the world being empowered. We need to empower them at the grassroots. All right. So if you guys have any questions, I would like to hear from you. Normalize therapy. I can't overemphasize that. Normalize therapy. Men, normalize therapy. Speak up. Speak up. Depression is treatable. We need to reduce the stats of suicides. On the stats, according to World Health Organization, it's women that we are told are more depressed than men. But why do we have men committing suicide? It's because as a society, we also have failed men. We have failed our boy children by making them suppress their emotions. When your boy child is hurting, normalize that. Go to his attention like you would with your girl child. This is the phase, this COVID 19 has taught us that we are all vulnerable beings. Normalize a man that is hurting and don't start using names to belittle him. Because once we start doing that, or with your boy child, they go into that shell and it takes time for them to come out of it. So let's normalize it and let's utilize other things. Art is part of the things I have utilized in the past 10 years. A lot of times people ask me, how do I keep positive? I utilize things that are outside medicine. You have to look at other things, yoga, meditation, mindfulness meditation, where you can connect with your inner core. These are the things that we need to start normalizing them. The present moment. What are you doing now for yourself to connect with the world around you, the nature? I believe it's Norway. Doctors have started prescribing going to the nature for their patients, because we know that when we absorb that fresh air from the nature, from the forest, it's good for our emotions, it's good for our dopamine, it's good for our serotonin. Watching art is one of the things that has helped. Even in I was looking at a study that was released by Harvard Medical School. They were talking about how art even helps reduce the decline of your neurological senses, your neurological system. So it basically helps that parasympathetic system, your nervous system, to keep active and be able to learn. So utilize things like art, utilize things like music, find a new hobby, get into theater, get into sound music, get into something that will stimulate your happy hormones. All right. So as I close, I'm gonna again share with you the slides that Rafia has actually created in his. We collaborated. It's been 15 years. I've been wanting to do this with him, but the time was not right for me. So it is such a beautiful moment for me as we focus on mental health, more especially during this time. I felt this is our time to collaborate and bring to your side the work he has done around the world. His work is around the globe. He's worked passionately with Department of Arts, Sports and Culture, Department of Health, and the galleries, the museums in South Africa. So it's time for me to share him with the world. And if you want to have his piece of his work, commission work, let us know. Drop us an email. I'm going to play the slide right away, and keep in touch. And again, for the men who are new dads out there, remember this: you are human. Feel feel your emotions and validate them. They are real. And again, I wish you all the best. I wish all the best to all the new dads and the new mothers. May this be the excellent years of your new fatherhood. And remember, there is no perfect fatherhood, there is no perfect motherhood. Parenting never came with any protocols. You do what's best for your child. But before you become the best father, you need to be well in your headspace. You have to be well in your headspace, in your physical being. So, what you can do is to do the best you can, utilize things that are of nature, these little things. If you think that you are struggling, don't sit back with your symptoms. There is help out there. Find someone to talk to. Find a therapist you can trust and share. And I always say, if you cannot connect with me as your therapist, as your physician, fire me. Fire a therapist you cannot connect with. If you feel you cannot share your vulnerabilities and your being, your truth, it's not working. So, again, thank you so much for watching. I'm going to leave you guys with this: love the children that are placed in your souls and your hearts. Sometimes children come in the form of adoption, and this does not downplay the fact that even dads, new dads to an adopted child, could affect the way that father views the world. So any child is a gift. And again, I wish you all the best to all the new dads out there, and know that you are the greatest dads. Try your best. Try your best. Have family around you. Have friends to help you. Talk to someone. Share your insecurities. Share your fears. Women, as we talk about our insecurities, you are also able to do so when you allow yourself. Okay? So, you guys, thank you so much for watching. Next week, we're going to come back here same time, same place. We connect here with all other thought leaders. We talk about things that matter to us as a society. Because when we get these things from people that have learned these things, that have all the scientific background, it's always important to connect with such, because it's all the proven stuff. I love science because it's proven and it's true. All right. So, you guys stay safe with the COVID. Have you vaccinated? Drop me a comment here. Tell me if you have, and if you have not, share your thoughts. I know there's a lot of fears that have come with this COVID-19, but just remember, all this is science. Science cannot lie. And again, it is making a difference. So vaccinate and save the souls around you. We're starting to see COVID-19 affecting new babies. So as we move towards the fourth wave, apparently in the world, there's a fourth wave now. Be safe, protect your little ones in your world. All right, you guys take care. I'll see you next week with a colleague here. God bless.